Welcome to Gracefully Graying Livestream. Gracefully Graying is a startup to connect you to resources and information about growing older and for assisting your loved ones. We provide articles, interviews, checklists, and other tips to create a productive and vibrant life. We also have many resources for people moving into later life stages and how they can be helped by those around them. You can find us on gracefullygraying.com and social media platforms. So now enjoy the live stream Gracefully Graying show. Welcome everyone to Gracefully Graying. Today we are welcoming Dr. Bruce Smoler of Smoler Smiles, and we are going to be talking about senior specific dentistry. So I'm going to call you Bruce.
Okay.
Hi, Bruce.
I'll call you Laurie.
Okay, great. So welcome to the Gracefully Graying live stream. I know you have a lot of great professional information to share with us, so we are excited to have you.
Me too. Looking forward to it.
So to start out, Bruce, give us just like a brief background of how you started Smoler Smiles and share with us the training that you've received that allows you to specifically serve the senior population, or the 50 and over, which is obviously our demographic.
Great. Well, Laurie, that's a great question. As a second generation dentist, I was brought up in the field of dentistry. I was at Michigan undergrad at Ann Arbor for 3 years, finished early, then went to Northwestern Dental School in Chicago. Best 4 years of my life. And it's where I met Miss Wright. And it wasn't until 5 years later that I found out when we were married, her first name was Always.
What?
So Always Right.
Oh, Always Right. Okay,
yeah.
got it.
So I learned that early on.
Okay.
And I had a very strong interest in surgery and helping patients with advanced procedures and treatment. I was accepted to become a periodontist, which is a gum specialist. And my father, his words of advice were, Bruce, you should at least be a general dentist, at least for a year before going back to specialize. Well, I took his words to heart, and the 1 year became 2, which became 4, and never really looked back at just limiting myself just to gum surgery. But the idea of learning more and more in the chosen profession that I decided to spend my career with was very intriguing. So learning, taking courses across the country, from world-renowned clinicians really propelled our training and our surgical treatments that we were able to provide for our patients. So being able to innovate, have a lot of newer techniques and procedures to help patients, not only as far as the outcomes, but also the ease that is able to be provided. So my father retired about 15 years ago. When you look at the demographics, oftentimes the age of the dentist represents the age of the patients.
Oh, so that's interesting.
Yeah, because you think about the patients kind of mirror the age of the practitioner. So with the unique opportunity to have a lot of senior or older patients as a younger practitioner allowed me a lot of insights that most clinicians would not necessarily be aware of. So through the years, really having a lot of emphasis on seniors, how to help them live each day at a better life expectancy with more opportunities to feel whole again became very important. So my area of expertise is dental implant reconstruction. Been placing dental implants for over 30 years, training and teaching dental implants across the country, whether it's putting on local programs or going across the country internationally on occasion to really help my colleagues learn more and more about what unfortunately they know less and less about. So we are pretty fortunate to be able to help all different types of patients, but specifically older patients who are missing teeth and really struggling with the fact that maybe for 5, 10, 15, or 20 years, they've been dealing with partials or dentures, and no one has really been able to help them. So we're very blessed and fortunate to really focus on that segment of our population.
Right. So, I mean, obviously that you could say that sets you apart from other dentists, that, you do have general dentistry, obviously, as you mentioned, but you are an implant specialist.
Right. So in our office, we have associate Dr. Alan Olenek, who's very good. He's a very gentle man, tall man. He's about 6'4". So,
Okay.
any of the cavities in the back of the mouth, he can easily reach. So he handles a lot of the general dentistry while I focus on the more complex surgical procedures. And that's really a nice niche because he's able to help the patients that may not qualify for services that I provide, and allows me to focus on the types of patients that truly come from all across the country and even sometimes out of the country on the services that we provide.
Right. So that's an interesting point. So explain that more. I mean, normally people think, well, I'm going to go to the dentist. I'm picking a dentist, choosing a dentist, and the dentist probably has patients that are, I don't know,
Right. 3
15,
to 5.
20,
Yeah.
maybe 30 miles radius from their
Right.
office. But you're saying something very different.
Right. So when you start looking at patients who have been suffering and they've been told that they've got a hopeless condition,
Oh, yeah.
imagine how disturbing it is where you've gone to maybe 5, 8, 10 different dentists over the course of 20 to 30 years. And they tell you, I'm sorry, nothing can be done. It's hopeless. Well,
Really?
oh yeah, happens every day. With the explosion of social media helping to spread the word about what's possible, it's been truly a game changer. And being able to use teledentistry every day, almost every week, we have teleconferences with patients from out of town. We're located 15 minutes from the airport, so
Right.
it's an easy commute for someone from North Carolina, Indiana, Ohio. We have patients from Toronto, New York, Florida, Texas, talking to patients in Colorado. Online, I have a conversation, and this woman was asking questions about dental implants. And she said, where are you located? I told her in Westland, Michigan. She says, where's that? I said, well, that's in the Midwest of what? The United States. I said, where are you? She says, oh, I'm in Akaburo. I go, where's that? She says, oh, about 70 kilometers the other side of Auckland in Australia.
No kidding.
So I said, well, plan ahead. We don't want to be late for your appointment. So truly, when you're dealing with the internet, you can connect to people on a global basis. And when you have training and the type of techniques that we provide, less than 0.5% of the dentists, and there's about 140,000 dentists in this country, have our training. So truly, we provide world-class care right in your own backyard.
Right.
So patients will travel 40 minutes, an hour and a half to go to their favorite restaurant for a special event. But too many times they think, well, I'm only going 15 minutes to the dentist. Well, for regular cleanings and maybe a filling, that's one thing. But full mouth, total mouth reconstruction
That's a
is a little
special
bit
event.
different.
That's a
That
special
is.
event. Yeah.
Yeah. Worth the travel.
Yeah. So you mentioned, the teledentistry. I mean, so you would maybe have the first consult session with somebody
Absolutely.
and then they'd say, oh, you know what, this is a possibility. I'm going to book a trip, make an appointment, and then they fly here or drive here long distance to come see you.
Right.
Yeah.
So there's actually a long haul truck driver from Arkansas, and we connected via Skype. This was a little bit before Zoom. And the way teledentistry works is it's a really nice segue into what's called a digital workflow. So this long haul truck driver connected with us online. We were able to find a local lab nearby that he was able to have his mouth scanned. We did a conference as far as his smile. We actually have a digital design studio for their smile online. And the day he showed up to our office was the first time I met him, and his teeth were all ready for the surgery.
That's amazing.
So it's absolutely incredible. I mean, it's like Tesla great.
Yeah, that's great. I love that.
Yeah.
So Tell us about there are various types of implants, correct?
Certainly. Yeah.
Okay.
So many times the standard type of implant is probably about 9 millimeters, maybe 12 millimeters long. And there's certain locations or places that they'll go. So when you look at maybe about 3 million dental implants are placed annually, then most of them, I would say, are the standard type of dental implants. There's a small segment that's called mini implants, but those are really limited and not really well thought of in the community because of the inherent problems with an implant that's very small, skinny, doesn't offer as much support. So when you get into more involved procedures where patients may have had a denture for 5, 10, 15, 20 years, bone loss occurs to the point where regular standard size implants do not fit. Well, we have options called Zygomatic or cheekbone implants. We're one of the few providers in all of Michigan with it. And so what it does is allows us to help more patients that previously had very few, if any, options. So those range about 30 millimeters to 50 or 60. So it does sound a little bit scary, but it's really nice because our goal, our mission is to help each and every one of our patients live a better life. And being able to do that with a lot of different options, whether it's on the lower end as far as time, effort, and expense, or on the higher end with more involved procedures, it truly gives back what patients have been missing for many times, most of their adult life.
So when you're talking to patients, and I know it's expensive and, whether it's covered or not covered by insurance, but
Sure.
when you have to talk people into this, or you have to
Well,
say,
what it comes down to is there's the need.
yeah,
There's 24 million denture wearers in this country.
really.
There are more people with dentures in the United States than the population of Canada.
Okay, there's a statistic. Okay.
Yeah.
Yeah.
And so
Yeah.
the next time you're out with your friends socially, by the way, did you happen to know
Yeah.
that there's more people in
Yeah.
America with a denture than people
Right.
living in Canada?
Right.
So what happens is they become a lost society because think about the mindset of 99.9% of the dentists out there. Here's your denture, all your troubles with root canals gone bad, all the troubles with broken fillings are gone. You're done. Here's your set of teeth.
Mm-hmm.
And sadly, most, if not all of those types of dentists have what I call a disease that's too common in dentistry. It's called stinking thinking. They just don't know what they don't know.
Oh,
And
interesting.
the life expectancy of a person wearing dentures on average is 10 years less than someone that can chew their food properly. So
Oh,
what
wow.
happens is,
That opens up
yeah,
a whole different ball game, right?
conversation, certainly.
Which we will get into in our next interview, another one, but because
Okay.
that has to do with diet and health and all that.
Nutrition and
Yeah.
just psychologically knowing that
Yeah.
when you go to a buffet, that you have to seek out not the food that you want or the food that you crave. Oh, let's see, what's the softest food I can gum?
Oh, right.
Or what's the softest food that
Mhm.
I could actually chew without
Mhm.
pain?
Mhm. Oh, yeah.
Or in some cases, what can I do so my teeth don't flop out onto the table
Right.
where everyone's trying to eat?
Yeah. Little embarrassing. Yeah.
Yeah,
So many
that
issues
bad
that,
form.
yeah,
Right.
so many issues that come around with that. So on that note, I mean, still on the implant. So bone augmentation is used
Yeah,
for people who don't have enough healthy natural bone to
exactly.
support their dental implants.
Right.
So what is the cause of this? And then you fix that. I mean, what are your solutions?
Right. So when you're talking about bone loss, there's two general categories. One is if it's associated with an individual area, so like a segment of the mouth, maybe one, two, or three teeth. In those situations, we can actually regrow bone. We're one of the first offices in Michigan to actually use stem cells, where we have staff trained to be phlebotomists, draw blood, put it into a centrifuge, and filter out bone morphogenic proteins. So there's BMPs, as they're called, allow bone to grow faster, the site of the placement to heal better, because we're actually using particles of the antibodies in a patient's body to actually help it heal. So being able to do things more predictably, easier and quicker with less pain and discomfort is a real benefit for our patients. So the second area of concern is when there's a larger area of bone loss, or it may be for the whole jaw. And instead of doing a procedure that for decades was what's called a lateral or full sinus grafting, we do the other procedures, as I mentioned, as far as Zygomatic. So when you start looking at additional training in additional ways, what used to take 9 months to 18 months can be solved or handled in a day. So we don't have to do sinus bone grafting or sinus bone augmentation, because the larger cheekbone implants called the Zygomatic, which goes from the cheekbone to the upper jaw, allows us to do things more predictably. So in certain cases, we build up bone where we need to build up bone. Yeah. In other cases, we save thousands of dollars and many months of wasted treatment by having alternatives to the classic option, which is what I was taught 25 years ago.
Right. So, yeah, so interesting. So that brings me to my next question. Good segue is that it's all about new technology and innovation, correct?
Yeah.
Like, so you're obviously keeping up on that.
So it's amazing. Over the last 18 months, we've never invested more time, effort to really truly make a difference in the technology. My father has always been very geeky in that sense, having equipment that was first to market. And he always liked being a beta tester for the different materials or procedures. So the analogy I use for our patients is when you take a video, do you have this big boxy thing on your shoulder called a camcorder to take a video? Or do you use a smartphone to take a video?
Yeah.
So technology innovations is what drives us on a daily basis. And so what was done even as short as 6 months ago is passé in our office.
That's how fast it changes.
Oh my gosh.
Wow.
And the crazy thing, we bought a 3D printer last year. With the supply problems, we waited and waited. Then you have your software, you have the materials. Yeah. So just in 6 months, what used to be the leading procedure now is outdated. So now, of course, we get the newer, better, and faster and greater materials. Yeah. So it's really a constant mindset. Being able to be the first and only in Michigan with a dental implant assisted robot called the Yomi. They go hand in hand with our philosophy in the sense that technology doesn't drive us. We allow the technology to make the experience better. It's not technology just to have technology, but really making sure that it's applicable and user-friendly. So that's really the key, knowing enough to say no and yes with the right technologies.
Right. So you were the first in Michigan to use the Yomi technology?
Yeah. So the Yomi robotic assisted device is a game changer. It allows us to do things minimally invasively. It allows us not to peel back the gum. It's more accurate than the human hand. So as we say, more precision with fewer incisions.
Right. So you just really have to educate people. Like, this is what we have.
And you know what's, Laurie? Most of the people I have to educate are other dentists.
Right. You know, I know that I know that there are dentists who, you know, just keep, you know, doing the same thing, same technology.
Same old.
It
was good enough for the 1950s. It's good enough for the 2000s.
Right. Very interesting. So what are the costs of dental implants? I mean, and then there are additional factors. I mean, that could affect one's cost either way, depending on specific case. But
so overall, generally speaking, patients will spend anywhere from $2,000 on up to many tens of thousands of dollars based upon a number of factors. If it's just one tooth, a series of teeth, the whole mouth. So the nicest thing about what we're able to do is that the technology allows us to do things quicker, faster, more accurately. So that's actually one of the best ways to keep prices down. When you look at innovation, it allows us to do things in a matter of minutes, not hours. It allows us to have things done in weeks, not months and months. And furthermore, from a business standpoint, it drives our costs down. So in the past, if something were to cost us $1,000, well, now that $1,000 is shrunk to maybe $10. So sure, there's a huge capital investment as far as the equipment and the technology and the people to run the technology and the equipment, but it allows us to be very competitive on pricing. It allows us to offer services that really decide what's best for our patients' care and their overall well-being.
When people think of going to the dentist, they're nervous about, if they're going to have a procedure, about an IV sedation, whether it's local, whether it's general. Right. How do you ease people's fears with this?
So one of the things that we do is we try to have a level of humor in the office. So when
humor's always good. Okay.
Yep. So when patients will say, I'm scared or nervous about something, my typical response is, well, if one of us should be nervous or scared, it's much better that it's the patient rather than me.
Good answer.
Yeah, absolutely. Patients will say, I hate going to the dentist. I said, well, I go to the dental office 4 days a week, and I have no problem with that. So we really try to at least calm patients down.
Yeah.
First and foremost is listen to their fears and acknowledge them. Too many times when I lecture across the country and I interview staff, and I do a lot of on-sites, or at least I used to do a lot of on-sites in other offices, I would observe the staff telling patients, oh, you're fine. You're fine. It's not a big deal. You're okay. You're okay.
Like already setting up that, oh my God, should I not be fine?
Right. And it invalidates the patient's legitimate concerns. So when you have an adult who knows better that, yes, I don't need a lecture, I don't need to be berated that, oh, how did you let your mouth get like this? The last thing you need to do is berate the patient or just invalidate their concerns and fears. So when they start talking about their past experiences, and sometimes this is a traumatic event, almost like post-traumatic stress disorders. I mean, it's awful, the stories you hear. And you have to acknowledge them and go, I hear exactly what you're saying, and you'll be okay. We're here to help. And so it's just that extra minute. And we highly select our staff. Our team is what makes us as successful as we've been. And it's really the idea that our team understands the concerns of these types of patients. And the last thing you want to do is make them feel bad about feeling bad.
Right. And at the end, they're going to feel so much better.
Right.
Feel better.
So whether it's IV sleep sedation, where they have the IV in the arm, they go to sleep, whether it's oral sedation, you just take a pill to relax, whether it's the relaxing gas and nitrous oxide, which always makes for a fun event. And of course, the local anesthetic, there's different techniques and tips. And to have my associate, he recently gave me an injection. I didn't feel it at all. I go, wow, no wonder you're so well liked. So it's really the simple things as far as just giving a painless injection.
Right. You just did that just to experience it again, like, oh, this is or were you having work done?
I actually gave myself a dental implant with a robot.
Oh, really? Yourself?
So,
Wow.
so if it's good enough for my patients, it was good
Wow.
enough for me. So
Interesting.
there's a few things that we are about to like let people know about. My wife says, Bruce, what the hell? You gave yourself a dental implant? Well, at
Wow.
least you're not telling anybody about that.
And
Well,
now
with
you
the
are.
yeah, well, yeah. So with the robot, you pre-planned the case. So I knew exactly where the surgery was going to be because I planned it out ahead of time on the computer. And then what we're able to do is actually utilize the robot to place the implant.
Hmm.
So I actually have an image here of my own. Oh, we'll see. We could probably put that in. So that's actually my
Well,
dental implant that I placed myself
huh.
with my staff there. So it's really a unique experience to actually go through what my patients experience, but it
Yeah.
was completely safe. First time anyone has done something like that in Michigan because
Yeah.
the robot, the technology, if you understand the robot,
Mhm.
people say,
Mhm.
oh my God, that makes a lot of sense. You could do it yourself.
Mhm.
Well, it's not
Mhm.
just because I'm a do it yourselfer, it's because I understand the technology. It's really a foolproof way to have it done.
Yeah.
So I mentioned that to my wife, and she says, wait, who's the fool?
Yeah. Well,
So,
hopefully it
yeah.
turned out okay. Did you do a
Well,
good
it's still in there, so
good
I
sign?
gave myself an A+, and I
Okay.
didn't feel a thing.
Oh, wow. Yeah, really
Yeah,
never heard of that, but that's
yeah.
interesting.
Film at 11. We'll see what happens.
Yeah, right, right. Okay, so there is so much more to talk about,
Yep,
but that's it for timing on this. But this was
right.
great information, at least, to educate people on implants, introduce yourself, that's great.
Sure.
So tell us all the ways that people can get a hold of you.
So Smoler rhymes with molar, so it's
Okay.
real easy.
Uh-huh.
Smoler Smiles is what we're known as. You
Mhm.
could Google us, you could go online, whether it's LinkedIn, whether it's Facebook, whether it's Instagram, whether it's on Twitter. Look for the big banner in the sky off of an airplane, maybe. So we really are focused
Really?
on, well, not yet, but
Like at
we
a football game, maybe?
maybe in the future, we'll see. Maybe the
Okay.
Senior Olympics.
Oh, interesting.
Yeah, I don't know. So the main focus is it's only a simple phone call away,
Mhm.
734-629-4306. And my team is there to help whichever way we can. We go online, we do Zoom calls, we do Skype, we do WhatsApp, we do FaceTiming. So
Yeah,
whichever ways we can help, have your grandma, your parents
right.
sit down with you so that many times it's the caregiver, it's the
Mhm.
family to help the parents or grandparents feel better because not everybody is as tech savvy. We offer different ways to come on in. So we have different services available, whether it's rideshare, whether it's Ubers.
Mhm.
Um, sometimes we'll have staff pick up patients or take them home. So there's a
Yeah,
lot of ways that we really try to help people contact us and get in touch with us as easy as possible.
nice, nice. Yeah. All right. Well, we thank you so much for joining us. Again, we're going to have you back and talk about,
Great.
in detail other issues having
Yep.
to do with seniors and the 50 and over crowd.
Absolutely.
So yeah. So thanks again. And thank you to everyone watching. Find us on gracefullygraying.com and our YouTube channel.